believe that our values, dignity, one team, compassion and safety and quality, should be the cornerstone of all the decisions we make. As such, we share lessons learned and stories at our Patient Safety Executive every week with staff from across the Trust, including clinical and non-clinical colleagues.
I was pleased that the Trust as a whole had recognised the importance of individual behaviours and the impact that that can have on your colleagues and of how we perform and care for patients. The formal development of the Trust values and behaviours has really helped us, specifically within the theatre department, to illustrate the impact of our behaviours amongst the team.
On my ward, the respiratory ward, we've changed the way we organise ward rounds so that consultants and nurses have relatives present on ward rounds to exchange information. If relatives can't be present, we even conduct interviews via Skype.
SASH is one of the largest employers of physician associates in the country. It's a very supportive trust and it's leading the way in terms of governance structures around our role capabilities and in terms of generating the first school of physician associates for the Kent, Surrey, Sussex area, supporting physician associate students and physician associates working.
SASH Plus presented the perfect opportunity for us to work with Virginia Mason, America's hospital, over the decade to develop some new tools and techniques to really help the hospital focus on patient safety, on quality, reducing variation and creating a better environment for our patients where we ultimately reduce costs and create better outcomes.
At SASH we've devised a tool to measure patient-reported outcome measures. This has been rolled out on medical and surgical wards and we have shown that it's feasible and has the potential to improve patient care and well-being.
All the training, so you can do all trainings that you want to do to improve your skills, and patients are very friendly and they're very appreciative. That's why I love working here in this trust.
We got 62% response from the staff survey, 17 questions scored on the top 20% nationally, which we are very proud of, show staff engagement and staff morale and improve patient safety.
The thing I love about the Patient Safety Forum is that all their opinions or suggestions are treated equally. Be you a consultant, be you a nurse, be you even an accountant, we all have an equal say, and that's important. We're all full parts of the patient journey, and it's important for all of us in our everyday jobs to feel that we are connected to the patient and make a difference to that patient's journey.
In our trust, we have a lower than the national average mortality rates, as shown by the indices HMSR and SHIMI. However, we're challenging ourselves by looking at particular patient groups, such as those who die after readmission, or if they've had a particularly long or short stay in the trust. In addition, in areas where we have high numbers of deaths, such as critical care where we are now, we ensure that every patient death is examined on a monthly basis to ensure that we learn the lessons from every patient.
The patient stories are shared at our monthly board meeting. It's a really great opportunity for the board to hear directly from patients and their families about our quality of care, experiences of services, but also it's really important that the board ground their decisions and priorities and our strategy from directly hearing from patients.
I'm very proud of the staff at SASH. We employ 3,600 people who are experts in what they do every single day. We looked for a way in which they could tell us the things that would improve services for patients, and we hit upon developing an ideas to innovation factory. This allows all staff to flag up ideas where we can improve. In the 6 months that we've run the project, we've had nearly 300 ideas come through from frontline staff, and almost all of them are being implemented by the divisions. It's a great success.
My role is to see, assess and manage patients autonomously, and the Trust have enabled me to do this through supporting my development and education. I'm really very happy in my role. I feel very supported. I have a great team behind me. It enables me to do my job to the best of my ability. I feel very lucky and very hopeful for the future that this role is going to provide great patient care and also to enable advanced clinical practitioners to excel in healthcare.